Hi, I'm the podiatrist, Dr. Sarah Flynn from the Wimmera Foot and Ankle Clinic, and I'm here today to talk about heel pain. Okay, so heel pain will probably be the most common condition that a podiatrist sees in a podiatry clinic. And there's many different causes that contribute to you getting heel pain. It's usually an overuse condition, like in relation to working on hard concrete surfaces. It can be a sporting condition. It can be due to your footwear, but it can also be due to the structure of your foot or the way your foot sits. So what is heel pain? Well, most people that come into the clinic complaining of heel pain, it's usually some sort of overuse condition, but it can also be caused by structure of your foot, flat feet, high arch feet. It can also be caused by sporting injuries, or it can be caused by hard surfaces that you're standing on for long periods of time, or different types of footwear. If you like to wear thongs in the summertime, or like wearing shoes that are probably not as supportive for your foot. Okay. So the most common cause of heel pain is a condition called plantar fasciitis. The plantar fascia on your foot inserts in your heel, runs along the sole of your foot, and then inserts into the bases of your toes. When your foot is under stress, the plantar fascia moves with pronation and supination of your foot, and it pulls from the heel bone. A lot of people will say, when I first get out of bed in the morning, when I first put my foot to the ground, it's like there's a nail in my heel. And this is due to first step pain, or when your foot's at rest overnight, everything gets cold and tight. You then go and put your foot to the ground, and it causes this tearing or this pain in your heel. Then a lot of people will say, as they walk around the bedroom, it eases. And then through the day, it starts to get sore again. And this becomes a vicious cycle that happens with heel pain and plantar fascia. So some common misconceptions about heel pain. A lot of people think that they have heel spurs. And yes, there is a large population of people that do have heel spurs, but generally it is the plantar fascia or some other less common conditions that are causing the pain underneath your heel. Now, a lot of people will come to me where they've tried to self-treat heel pain, where they've put cushioning underneath their foot or bought softer shoes. Unfortunately, this is usually pretty unsuccessful in the treatment plan because it's actually creating an unstable base or too soft a base underneath your foot. In the cases of plantar fasciitis, remembering it inserts in your heel, runs along your foot, inserts into your toes, you need support. Something to stop from pulling from your heel bone and causing that heel pain. So as a podiatrist treating heel pain, quite often I want to know why the person has gotten the heel pain in the first place. So what I do is I assess the foot structure of the person, what they do for work, what their chosen sport is, what their footwear is, a whole lot of contributing factors to make the right treatment plan for the person. In some cases, it's just a matter of stretches. In other cases, we need to strap, we need to do shockwave therapy, we need to do ultrasound therapy, or in some cases, it's the actual bony structure of the foot causing plantar fasciitis, which means that we do orthotic therapy and address the footwear as well. So some things that you can address is getting your footwear right. This can make a massive difference with heel pain or plantar fasciitis. One, you want to make sure that you've got a good supportive shoe and a shoe that suits you right for your workplace as well. Main thing that you want to look for in a good shoe is that it should bend at the toes, it shouldn't bend through the middle foot, should have a nice firm heel counter, and you shouldn't be able to twist it, okay? You want something that is nice and supportive, something that fastens to your foot and is going to help to support and not fatigue your foot throughout the day. So thank you for listening to me about heel pain today. Happy to assess your feet and come into the Wimmera Foot and Ankle Clinic. I'm Dr. Sarah Flynn. Thank you.